It's a Northwest Lifestyle Weekend on Como News. IRG's Health Talk continues.
All right, our first guest today, Dr. Stephen Campbell, Chief Medical Officer at Providence Medical Group, the Northwest Washington service area, the Wuhan coronavirus, and we have the first known case of it here in our area in Snohomish a couple of weeks ago. And I want to say Providence Medical Group did a great job of getting this immediately addressed and under control. And we're going to talk to Dr. Campbell about this because this has been a big scare around the world.
Yes, absolutely. I mean, it's a unique situation, isn't it? I mean, to have right here in our backyard and the way Providence handled that. And I mean, national media was there. I mean, it's big stuff.
All right, here is Dr. Campbell and Shannon O'Kelly.
Dr. Campbell, welcome to Health Talk. How are you?
Hey, good morning. Fantastic. Thank you.
Like Tom said, you have a big role at Providence Medical Group in Everett. You're the Chief Medical Officer. Tell our listeners what that entails. That's a big job.
Well, Providence Medical Group is a multi-specialty group of physicians and advanced practice clinicians of about 300. We're in Snohomish County. And we have about 12 plus clinics, several specialties. We're part of the larger Providence system, and so our hospital partner is Providence Regional Medical Center in Everett. And I've been in that role for almost a year now.
So you run the aspect of the organization, which is the medical groups, which are the physicians or clinicians that are out in the clinics that are working around the hospital as part of providers for the hospital network.
That is absolutely correct. Jay Cook is my hospital counterpart. He is the chief medical officer at the hospital.
Got it. So you guys in Everett, Providence and Everett, have been in the news a little bit lately, and we want to talk about the coronavirus. And I want you to talk about, as a chief medical officer, as the Providence Medical Group, what's your role and how do you deploy action? Because this is a virus that we don't know what it is and how it's going to change, and it changes every day, doesn't it?
Yeah, it certainly does. And, I'm really proud of our group. As many know, the first patient in the U.S. was identified at Providence Medical Group and treated at our hospital. Our team did an amazing job in identifying the patient. It became clear quite early on when he presented that he may, in fact, have coronavirus. Appropriate isolation measures were taken, and ultimately he was hospitalized with good efforts to contain potential other exposures. So I'm really proud of the way my team at Providence Medical Group did, and then the work of all the people at the hospital has been just phenomenal.
Yeah, it's an amazing time for us. I mean, how does it work that these viruses? Maybe you can help me out here and help our listeners. How do they come out of China? I mean, what is the situation where it comes across the globe and starts in the eastern part of the world and comes across? Because SARS did the same thing. Yeah. What is it about that area?
Well, we live in a global village, and it's via travel, and so we're working very closely with county and state health departments as well as the CDC, and most clinics, and I can speak for our Providence clinics. Anybody who's presents with respiratory type illness symptoms, we're asking, one, have they recently traveled to China? Two, do they have symptoms of, cough and fever? And have they been potentially, around someone who has been in China?
So this is interesting because a part of our organization that is probably connected to a national organization, mostly like the CDC. I mean, how does that information get out? And do you guys have regular meetings? I mean, this thing changes so rapidly. We really don't know what it's going to look like. Does the medical community, the infectious disease community, really know what this is going to look like? Is it going to spread? I know containment's a big deal, but how do you communicate? That is pretty amazing.
So I can tell you from the ambulatory perspective, the medical groups, every morning at 7:30, all the chief medical officers from across Providence, from Alaska down to California to Texas, we're on the phone every morning at 7:30, kind of walking through what's going well, what are some of the wrinkles we're seeing, in consultation with our infection prevention specialists and input from, again, national organizations like the CDC as well as local health departments. So from there, a chief medical officer's role is then to cascade that information to the appropriate people, whether it's physicians, whether it's nursing, whether it's front desk people, who are often the first to see patients when they come in our doors.
Right. And so they know, pretty particularly speaking right now, that it's coming out of China. So you need to have traveled to China or been in China. I mean, I know it's changing every day, but is that kind of what we know right now as an indicator?
Presently, yes. a small number of cases in the U.S. There, at least at the time of this, there's been one person-to-person transmission documented in Illinois. But so far, knock on wood, it's been well contained, and because of great work for those who are having to care for these folks.
We continue our conversation on the coronavirus with Dr. Stephen Campbell and Shannon O'Kelly next on KOMO.
It's a Northwest Lifestyle Weekend on KOMO News. Now back to IRG's Health Talk.
More on the coronavirus now with Dr. Stephen Campbell and Shannon O'Kelly.
Dr. Campbell, again, thank you for joining us on Health Talk, and thank you for the information regarding this coronavirus. But let's kind of talk about just the flu. I mean, it's just not the coronavirus that's still out there or changing and is out there. We also have influenza. We're in the peak of that season, and that's A and B. So we've continued to need to be careful, watch our hygiene. Let's talk about what we can do in generalization to protect ourselves as we move through our daily lives.
Yeah, you've hit the nail on the head, Shannon. I mean, it is flu season, and we certainly, there's a lot of hype right now, and appropriately so, around coronavirus, but it is still flu season. Flu kills anywhere from 50 to 70,000 people a year in this country.
Wow. That many?
It's a big deal.
Oh, no kidding.
And so, most people who present to our emergency departments, our urgent cares, with serious fevers and coughs, it's probably influenza. And so, I can't overemphasize the importance that, if you haven't got your flu shot yet, please get it. Because if you don't get it, you're guaranteeing 100% that you're not immune to influenza. And then there's, the other things, if you're sick, stay home, wash your hands, even though, there's been some interesting press about Purell lately, at least it's better than nothing,
right, exactly.
So wash your hands, cough into your elbow, just to try to minimize the spread, whether it's flu, whether it's a cold, sort of common sense hygiene practices.
It's interesting because I don't know that the average human really understands how often they touch their nose or their mouth during the day. Rubbing your nose, going to your mouth. And if you watch someone throughout the day, it's probably hundreds of times. And that's really the transport right there, is from hands to mouth, inside your body. So washing your hands and not touching your face if you can help yourself. That I've heard that helps.
Yep, absolutely. And anybody who's had kids go to daycare, you get one kid in there that's sick, they play with the same toys, and soon, that whether it's pink eye, whether it's a cold, it roars right through the whole daycare for just the reasons you said.
Yeah. I'm thankful we live in the time that we live in because, we have these outbreaks. These are viruses. They're interesting, and hard to understand. But if you go back to like 1917 when the flu, there was neighborhoods that were just devastated. And we have people like you and organizations like Providence and physicians like you that are really working on containment. And that's really, that makes me feel safe. We have smart people out there doing great things.
Well, thank you, Shannon. I'm so proud of my team. I'm so proud of the organization I work for. We're really dedicated to the health of our communities, and to be part of, this particular, situation with coronavirus, and to be, at the national scale to help figure this out, how to prevent spread. It's an interesting experience. And again, I couldn't be more proud of the people that I work with.
It's a common thing for us as humans to panic, but we should just take precautions, right? We don't need to panic, just take precautions.
Exactly. And there'll be some that'll be taken for us. I see some airlines aren't flying to China now.
Right.
And there's been significant restrictions. But again, get your flu shot, cover your cough, stay home if you're sick. Common sense stuff.
Common sense. And don't get pressured to go to work by your work. I read something the other day that a lot of people feel pressure to go to work. I'm at IRG. I'm the president of the company. I want our people to stay home if they're sick. Don't bring those germs to work. Stay home.
Yeah. I think all of us healthcare providers tend to be a little stoic when it comes to that.
Yeah. Dr. Campbell, thank you so much for your time, and thank you for joining us on Health Talk.
Pleasure being here. Thank you.
You've been listening to Dr. Stephen Campbell, Chief Medical Officer at the Providence Medical Group, and again, hats off to them for the job they did with the coronavirus and the scare that it has brought to several areas, including the Northwest. And Shannon, Providence Medical Group, kind of leading the way on this.
Yeah, absolutely. You did a great job. Again, all about communication, right? Getting information out.
All right, next guest coming up right after this timeout on KOMO.